Hello, everybody, and thank you for joining us for another session of Chat Space. Today, we're going to be talking about misinformation. We have myself, Ted, we have Sadie, and we have Felice, and we're going to be just having a chat today. Um, let's get into this. Hold on, let me connect my headphones so you guys can hear me better. All right, cool. Misinformation. So, ladies, like, what's your idea of what misinformation is, and like, what does that mean? Like when you hear that.
I mean, for me, it's just misinformation. No, I'm just kidding. It's I think a lot of the times there's a lot of things out there. There's the internet, and there's you just hear things from other people, and so it's kind of like that telephone game where one person starts with with whatever quote, and they pass it down, and it gets changed and morphed, and by the time you get to the last person, it ends up being something different. And so it's crazy how quick people are to believe other things. And I'm not saying don't believe anybody, but just I always do like to double check. If I hear something and I'm like, really? Like, is that for real? I'll, try to do my own research and look at it myself. And in doing that too, wanting to make sure that I find factual things, because you can go on Reddit and go down these crazy conspiracy rabbit holes.
Yeah.
And it gets insane. And then you just question your whole existence and you're like, what is going on? And so, and things like that. And then people have YouTube videos, and they have series where they go over certain topics, certain things. And so it is so easy, I think, to get kind of sucked into it and start to believe it yourself. And I mean, while I do believe it's good to expose yourself to as many things as you can, it's important to try to make sure that you're finding factual things, and that whatever you decide to end up sharing with people, because you never know, it could harm someone. Like if you're spreading, right? I mean, given anything health related, or if it's anything, if you give someone the wrong information, it could harm them, and it can be harmful to people. So people always say be careful what you say or whatever, and it's just kind of making sure for me that I'll always make sure if I have to back something up, I'll make sure that I have the right stuff and I know what I'm saying, because I don't want to be talking out my butt, you know what I mean?
Yeah, no.
Nicer terms, but yeah, so that's my thoughts.
I have to kind of piggyback a little bit off of you. I think misinformation is definitely telephone game, and also people's own interpretation. You find it hilarious that people might, I can't even describe it. If you said that the sky is blue and it turns yellow at night, they forgot blue, but they get selective hearing and they just do yellow. And then it turns into something completely different. So now everybody's like, oh, the sky's going to turn yellow. It's like people are very selective hearing. They hear to respond a lot. So they don't even listen to the actual education part of it, or what someone's actually saying. They only take bits and pieces of that, and then they switch it and turn it. So to me, that's kind of what misinformation is overall, is that there probably is somewhere in there that's kind of factual, even if it is just basic, this is what it is. But there's something of it that's good that maybe somebody else heard something else differently and twisted it. Yeah.
Yeah, I think it's pretty interesting. I remember you mentioned the whole telephone game thing. When I was in school, I was in maybe the 6th grade, and it was around Christmas time, and the teacher, we went around, and I guess what she initially said was, I saw Rudolph and Santa, and it was supposed to just so we can see how information can change as it's going from one person to the next. And by the time, I want to say I was close to the end, and by the time it got to me, the message was so different than what it started out. What the way it started out, it was completely different. I don't know if someone just decided at some point that they wanted to spread a different message.
No, and
But
the crazy thing too is like I remember many instances in that game where it would be my turn and I would listen to what the person says and I'd be like, what? And you'd question it, you'd be like, what the heck does this even, because it would turn into something so random and weird. And I'd be like, okay, I guess. And then you go off to the next person and you kind of end up making it up and you're kind of like, I guess they said this. And that kind of goes into what you were saying, Sadie, that, or I think one of us said it, like, well, the way you interpret it and how you take that and then end up passing it on. So yeah, it's
so a couple of topics right now that are pretty big. So something that I've learned is any topic can be the subject of misinformation, like literally any topic, especially as it relates to health and medical based topics. Two that comes to mind. I mean, I know we work in the field of public health, specifically in HIV services. That is a huge area of misinformation. I think Dax is joining us. Hey, Dax.
Finally. Oh my God, computers. Ugh. Was trying. Okay.
It's all good. We just began to kind of discuss how, medical, and there's a lot of like medical and health misinformation out there, especially as it relates to topics like HIV. People are to this day terrified of the idea of HIV and STIs as well because they don't know. And the information that's out there, there's so much information out there, and a lot of it is just completely false and completely incorrect. Can you all think of any type of like myths or things that are just put out there that you may have heard from people in regards to HIV that is just way out in left field that, we actually need to, break those myths down, let people know like, hey, that's not true.
Yeah.
I mean,
there's a ton.
There's a lot. Do you have a list? You ready for a pen and paper on this one? Because there was a lot.
Yeah.
There's a lot.
Like, you gotta wash your dishes separately. You get
It's
your
airborne.
Yeah.
Saliva,
people think that it's
or
very
touch.
Yeah.
Thank
I had a supervisor one time, and he was living with HIV, and he was the patient he had in front of him was like, I'm scared. I'm scared of this, and he's like, I think that you can get it from touch, and he goes, well, let's find out. And he touched him right on the hand. He goes, let's see.
I mean, that's how you do it, though. That's how you do it.
It's like this scaring folks.
I think people still think only men can get HIV. And I think one of my it's not really a myth, but or I guess it's more like a stereo, or I don't know what we would call this, but it's so funny to me how people like you say HIV or STIs and they say, ew, gross. And to me, I'm like, everybody has sex, y'all. Like, I just hate the gross stigma so much. And like, even both, they're like, HIV is manageable. STIs most are treatable. Like, and it's like, there's nothing like gross. Like, I mean, like, and I wouldn't call it like a myth or something, but that's just something that you always bring up and people are like, ew. And it's like, what do you mean?
Yeah. I'm like, what?
Yeah.
Especially like a lot of people think like, especially like the whole thing with like women, like you start talking about STIs and like HIV with women, and they're like, oh, I don't get that. I'm perfectly fine. I always talk to somebody. It like there's no way that I can get it. My husband is very much straight. I'm like, okay, like, so I think you got this completely confused. Like, what? So a lot of women like that. They think that their husband has to be, he also has to sleep with men for them to get HIV too. Like, they don't think that you could pass it possibly to him. Like, they don't know that. Yeah.
Yeah. People don't know. And like I said, there's just so much out there. On WebMD has a lot of myths that are, a lot of things that are incorrect that people often think. And some of those are, I can get HIV by being around a person who is HIV positive, just by being around them, not touching them, not drinking behind them, just by being around these people. There are those who think that they can contract HIV that way, just being in the presence.
So you mean if I'm like standing next to you in the same room, then I'm gonna get HIV? Is that what it is?
That's what some people think. Yeah.
Oh,
And these I bet are the same people that are like real wishy-washy on washing hands and masks. And, like you're worried about the wrong thing. Like
if it said COVID, I probably would believe it, but HIV, no. Maybe. Like
I mean,
And
too,
then-
and then a lot of people don't know that PrEP exists and that there's actually
yeah.
a way to prevent it.
yeah.
By taking a medication, and that it's 96% effective. Like when taking
99. It's like 99.
99
Yeah.
when taken correctly, 99% effective against preventing HIV. Like that's crazy, and
even
no one
some
knows.
people know about PrEP, and PrEP for some reason somehow now has the stigma on it.
Yeah,
Yes.
it does.
That's like,
Like
I'm not
you're
gonna
only
do that.
taking PrEP because
because
you
COVID.
are a slut. Like you're like, oh, you're taking PrEP because you're a slut. That's why you're taking it.
I think it's the funniest thing. So, like, even in the medical community, there are so many medical professionals and doctors who really don't understand the science behind PrEP. I mean, for example, in the last week, I've had to go to like a couple of different doctors, like maybe I'm gonna say like 3 different doctors for things. Like I had to go to the dentist and a couple other specialists for things, and they want you to write down, what medications you're taking. And I'll, write down, hey, I'm taking this daily medication, Descovy. And the first question they ask, do you have HIV? It says for prevention on here. Like I put Descovy for prevention. Like, why are you asking me this question when I clearly stated what the use is for? But it's like it's that assumption. It's that assumption because they don't know, because they're not prescribing the medication. They know that, okay, this has something to do with HIV, but they don't, I guess, realize that, it's for prevention. And people are even scared to take PrEP. I mean, like as you stated, Dax, like people are scared to take PrEP. It's a huge stigma associated with it. And like the people think, oh, you're a slut, you're a hoe. They think, oh, you have HIV because you're taking PrEP. Like that's not the case. And it's causing so many people to not, protect themselves. And I know in the Black community, there is still a huge gap in the number of individuals who are on PrEP because of those reasons. Oh, I don't want somebody to know I'm taking this. They're going to think that I have HIV, or I don't want my friends or anybody to think that I'm some type of, slut or some type of hoe or anything like that. It's like, no, like that's not what it's about. It's about you protecting yourself. But, we have to, I guess, kind of help people to realize that and help them to know that it's even there in the first place, because many still don't know.
I think that's like a great, I mean, again, I'll keep saying, as long as you have factual, like, you're not, again, misinforming people, but like, that's the cool thing about it. If you come across somebody that is misinformed and you know something about the subject, whether it's PrEP or whatever, share the knowledge, like, break down the stigma, try to help educate other people, make sure that, they are correctly informed, because it could positively impact them. If someone is scared of PrEP because, they're worried about, or what they've heard about it, like, oh, you have to have HIV to take PrEP. It's like, no, it's the opposite. So I think
Where did you hear that? Where did you hear that? Where did you, like, that's what I would do. Where did you hear it though?
Mm-hmm.
Who said? Who's they? What?
Yeah.
Clarify, please. Let me know.
Someone in the comments.
Let them know, and then tell them, whoever you heard it from, tell them that this is what it is and this is what it does.
And then it's so bad, like you were talking about, like providers and how providers are even uncomfortable. Like I have met a few providers that are so uncomfortable prescribing PrEP. Like I remember I was getting my PrEP refilled at the time when I was taking it, and I went in there and they were like, oh, what medications do you take? And you're like, oh, I take, Truvada. And they're like, you take what? Who prescribed that to you? And you're having to now like tell yourself, like you're having to explain to them why you have it and explain to them why you felt like you needed to have it. And at that point, I'm like, I don't even want to take this now, because I feel like every time I'm going to talk to my provider, they're slut shaming me right now.
I wish they would try. I wish somebody would try.
It's different for girls though. Like they don't think I don't know if it's just that they are like I remember actually going and getting prescribed first for it. They like talk me down about it. They're like, "Are you sure that you need to get on it? Are you sure that you need it? Are you just taking it because you know some people that are taking it?" And I'm like, "No, I'm sitting here telling you I'm not in a monogamous relationship. I don't know what he's doing. I need it." And you're like, "No, no, 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 you'll be fine." So I'm like, the only reason why they probably prescribed it to me at that time is because of where I worked, because they fear I knew a little bit. But I could just imagine, like, if you did that to me, you did that to somebody else in the community that, doesn't know anything, that just knows that this is something they need to take. You know what I mean? Yeah.
For sure. Someone in the comments was saying access to prep seems confusing for some, and a lot of people think that prep will be too expensive without knowing they can get it for free or low cost.
Yeah.
What's our process at Prism Health regarding like how people access prep?
Like for me, like if I'm out testing or someone says they want to get on prep, I put them in contact with one of our prep coordinators and I do a warm handoff and I let them know like this is Brian or Sophia or whoever, whichever one of my lovely friends I'm gonna pass off. You see the sun is all on my face here. And that person just calls the patient and talks to them about it. I make sure that the patient understands way ahead of time, like prep is a commitment. It's something you do every day. It's something you can do wrong. So you need to do it correctly. But when you're ready to get on it, I've got a person who can talk to you about insurance and talk to you about costs and walk you through it and make sure that we figure out the best way to get you on it. It's a two-person thing. You will be guided. So don't be scared. Like, it's okay.
Yeah, and I did prep for a while. I was a prep navigator for a little bit. And yeah, exactly what Dak said. If someone's interested, we'll get or the prep navigator with the notification and reach out to the person. And there's a patient assistance program which helps pay for it. So you will be paying little to no cost for prep, regardless of insurance, whether you have it or not. And then yeah, we go over most sessions if it's your first time. We go over what it is, how you have to take it every day, the side effects, things like that. Make sure that people know. And you can stop at any time. It's not like a thing you have to continue. If you decide it's not for you, then you can, I guess, quit anytime. So, and then get back on anytime as well.
Exactly. But yeah, I think it's really great. And like I said, we just have to really continue to push forth the message about these things regarding, how HIV is actually transmitted, which those ways regarding like touching people and stuff like that, that's just simply not even the case. But, people don't know and they're afraid, it is something, it's transmitted through, bodily fluids such as like semen, and it can be transmitted through blood.
Semen, blood, breast milk, vaginal and rectal fluids.
Mm-hmm.
That's it.
That's it.
I don't think so. That's primarily it. I mean, because with the way things have changed, like some of those other ways that HIV used to be transmitted, it's not something that happens these days. Like back in the day, maybe like many years ago, you had to worry about like blood transfusion, things like that. That's not something that happens today because
Right.
any blood that is collected, it is tested for HIV and other STIs before it even through that whole collection process. And even as it relates to breast milk and things like that, people who are on medication if a mother is living with HIV and she's taking her antiretroviral therapy and she reaches an undetectable status, that's not something that is much of an issue.
Right.
I do believe it's still not recommended for mothers to breastfeed who are living with HIV, but I mean, there's so many different medically based interventions that are helpful these days for reducing risk that it's really not as much of an issue as what it used to be. But it is still an issue. It's still an issue because people don't know. People don't know how HIV is transmitted. People don't realize that there are so many ways that they can protect themselves. Oh, I don't want to wear condoms. That's fine. You don't have to wear condoms. Even though, hey, if you want condoms, we can give them to you for free. But freenicepackage.com,
Yeah.
a little plug. But yeah, I mean, there's so many different things that you can do, especially in today's time, because there are so many grants and things out there. If you don't want to come to us for like prep, you can actually there's places online that you can sign up to get it for free. I mean, there are a lot of options out there for it. And oh no, Dax
Do
went
we
away.
lose Alex? Oh, okay.
Yeah, I think he was having connectivity issues. But yeah,
I
the
think one
other. Oh, go ahead. I'm sorry.
that I was going to think one thing too about like misinformation, and I know that I mean we're just talking about how instances where like our provider wasn't the most I don't know welcoming or just I don't know, but I think too I used to not ever ask questions when I went to the doctor. Like they would ask, "Hey, you have a question?" I'd be like, "No, I'm good." Like, and I would go ahead. Even if I did, I'd go ask my mom or like I'd Google it or something.
Right.
So I think too, and it really didn't start until I began working here, where I realized like there's a lot more that you don't know. Like you don't know what you don't know, you know. And so if you're at the chance where you're talking to someone who may be an expert on the subject or works in the field, again, whether it's HIV or anything else, like ask your questions and try to get, you know. And I do know that there is like medical mistrust and there can be misinformation from I would pray not, hopefully, like providers, but it can happen. But I think either way, you know, because sometimes, like I was saying earlier, we get into these rabbit holes on like WebMD or Reddit or something of what something could be. So if you ever are in the presence, just ask your questions. Don't be afraid, like, and try to educate yourself and get as much information as you can.
Yeah, there has to be some kind of like empowerment within yourself to be comfortable asking questions. Because you see, there's like a lot of websites like WebMD, Reddit, whatever, where people are sharing their experience. So one person's bad experience is like 1,000 people's now experience. So they're taking that one thing that happened to that bad person. It's like if you go online and you're in this place, this hotel is like supposed to be terrible. It's got like bad ratings, bad stars, and everything. And then you go there and you're like, hey, this was actually really nice. I read the reviews. The reviews are wrong. So it's the same thing when it comes to being able to like talk to your doctor. Like there has to be some kind of empowerment that we have to teach people better to like go in there, even if you don't know what you're asking, like at least ask, you know, because a lot of people are just like, I don't want to ask either because they're like, I don't want to know something because I don't want to have anxiety in behind knowing something that I didn't really want to know about. So no, I don't want to. Or two, they're like, I think I'm going to sound dumb talking to the doctor, excuse me, and then not knowing what I'm saying. But it's like, look, I don't care. This is about my health. I want to live a little longer. So I need to know what's going on.
And two, you can't you can't be afraid to ask a doctor. Like, you're not a doctor. How would you know? Like, or you know, like you didn't go to med school, so like ask the doctor if you're there. But I think it's so funny, Sadie, that you said. So I about the reviews like Yelp and Google. So I truly believe, I'm convinced that like if you go somewhere and everything goes as planned, like you got your food or you got your drink, it was good, you had a like if nothing went wrong, you're not going to go write a review about it because that was what's supposed to happen. So people only ever write reviews when something goes terribly wrong.
Yes.
Yeah. Or it's a situation where like it was above and beyond and you were like, that was exceptional. But if everything just went as normal, or normal, I say, but as planned, like you're not going to go write a review about it. So that's why I usually do not trust. I'll read them. I still look, but like, I'm like, people only ever write the bad reviews if it was except like if something crazy happened. But if you just wait, no one's going to say, oh, everything was fine. Like no one's going to go out of their way to write a review about that. Like, so.
Right.
Yeah.
Felicia, I think you made a really great point about like, you know, how the community receives information and like when they see different things. One major way that misinformation impacts the community is by causing a lack of trust. And that can be a lack of trust in government, a lack of trust in like the medical, their medical teams and doctors and nurses and things like that. And that's one of the reasons why now, even like with our current major pandemic that we're dealing with COVID, why so many people don't want to be tested for COVID, and you know, especially they don't want to get the vaccine because they are afraid and they don't trust that the information that's being given to them is factual. They feel like, oh, well, this vaccine was created way too fast. You know, there's still not, you know, a vaccine for cancer. There's not a vaccine for HIV. You know, it was just created way too fast. You know, how can I trust this? And I think that's one of the major issues that impacts us with as it relates to misinformation. And it's like, how do we build that trust when there's been so much? When you can Google anything online these days, and you find so much information, and it's like hard to know what can I believe, what should I believe, and I guess we know to go to reputable sources, but everyone isn't like that. A lot of people, they'll Google something, and the first thing they click on, oh, I'm having a headache. Oh no, it's cancer. Like, no, it's
I mean,
probably
I'm not
not.
gonna lie. I'm actually one of those people. Like, if I start coughing too hard, I'm like looking up WebMD, like coughing too hard for 4 days. Do I have something else? Like, that's how I was, especially before COVID. Like before COVID, I was like, I can't breathe. What if I have COVID? So I'm like looking up everything to make sure.
Sadie's like coughing too hard for 4 days. Women named Sadie.
And
because I want to make sure. I mean, I do that because I'm like, I want to know, what if I have something that I didn't know anything about, that I wasn't aware of. So I'm like, if I don't want to find that stuff up, I'm like, let me just find it up at home. So I am one of those people. I'm like, I will look up quick, fast, in a hurry to see like what it says online that it could be. And then I'm freaking out. I mean, that's how I kind of figured out about like STIs a little bit as I got a little older. Like I would read up on them and I'd be like, oh, well, this doesn't say if I put myself on a toilet seat or I'm sharing spoons that I'm going to get it, So that's when I kind of was like, okay, then yeah, that's whoever told me that was lying.
Right, and don't get me wrong. I think there's a ton of great information, available to us online. Like I say, it's all a matter of looking at the source. Yes.
Well, people are also just lazy. A lot of people just do not want to read. They do not want to read. They do not want to take the time of asking questions, probable questions. They don't like data. They don't like any of that stuff. They just believe whatever else. A lot of people are very much, they respect the opinion of people around them. So if one person, Johnny, says that it's bad, it's got to be bad.
And it's not only that, like, it's not the people around you, it's influencers. Like with social media now, people vlog everything. They put, and even with COVID, like people put up their, like my experience with COVID, and they like filmed it all and went through the whole thing with you. And like, and whether it's COVID or any other issue or illness, I think everybody deals with everything differently and it affects everybody differently. Like COVID does not affect everybody the same way. So what this person went through is not what you're going to go through. And then they're and it's crazy too with influencers, like people, they're like celebrities and people trust them with like all their heart, and will full on just believe everything they go through and that's part of it. They make themselves relatable. So you think, okay, well, if my favorite YouTuber had it or went through this, then like that might be it. Like, rather than looking up other sources.
Yeah, I think we can get Beyonce to promote taking the vaccine. Can someone call her? Can one of my Houston friends who may be watching this contact Beyonce and let her know that we need her to be in a PSA?
I'm not a part of the Beehive, so I wouldn't know, but
I wasn't either, but I got invited and someone paid for me to go to her concert, bitch. I'm telling you. It was phenomenal.
It was worth the money is what you're telling me.
Girl, she faked everybody out. See, they do the hat, the big giant.
See, no.
And one was away and you're like, that's Beyonce right there. But no. In the group with the rest of them, Beyonce popped out of the crowd. She flooded the stage with water and did a bunch of kicking and dancing, and I was crazy.
But maybe though, I bet you money, if you seen Beyonce take the vaccine, I bet you a lot of people would get the vaccine. I'm sure.
Definitely. They would. I know they would.
I'm not worried about Beyonce's fans too much. I want Larry the Cable Guy to get a vaccine.
Oh well.
I want Foxworthy to get a vaccine. I want that part, okay?
Our governor to get a vaccine.
Yeah, I need Hot Wheels to get a vaccine. I need.
That's y'all's governor.
That's not nice.
That's not mine. That's y'all's.
He ain't nice.
That is not nice.
Well, apparently,
very mean.
Our governor, or the governor, someone else's governor, does have a vaccine, and he got COVID, and got through it.
Yeah, he did get the
Thanks to
vaccine.
the vaccine. I mean, he's not promoting masks, but that's a whole other thing.
Well, maybe things will change.
I mean, that's the whole thing about the mask too. The mask thing, it was
Or
a
he's
big.
he's discouraging masks, is what it is.
Yeah.
Well, they did that big whole thing in the beginning. They were like, remember at one point they were like, no, don't wear masks. The CDC is saying don't wear masks, and they said no, just kidding. CDC said do wear masks. And I'm like, there's so much misinformation everywhere. You just have to be like, literally like sit. And I'm like, I'm just gonna wait until the president or freaking CDC puts like a news break or something, because if I listen to everybody else, I'm gonna be at the hospital every day.
I think what's crazy too is so I think up until now, most things we haven't had something new like this in a while. Or I think in my lifetime, this was my first experience going through something like that was constantly changing and brand new.
Yeah.
And so given these past couple of years, it has been very easy to be misinformed, and I know people were getting frustrated that things were changing every day, and but like in my head, for me personally, like that's expected. I'm like, we don't know, and we are constantly learning about how this works. We don't know how it works, and same thing with, I guess the vaccine. If people were it came out too fast, or there's the questions now about the booster and whether you get the third shot or not, and people are like, well, how do you know? And it's like we're kind of just going as we go, and there's no way to know about this except to keep informed of the new things that keep coming up, and it's still constantly changing. And we were just thinking maybe in June, oh, it's getting better, and it's just kidding.
Oh yeah, we said that, just kidding. No, I mean that I think people forget too, they have to test out some of this stuff on some people. Some people are gonna have to be some guinea pigs. It's not gonna be able to be.
I don't like the word guinea pig though.
I mean, but a science experiment.
Trial?
I don't know. There's a trial. Somebody's gonna have to be the person to stand in to make sure that this actual vaccine works. So it's you can't have. For me, whenever people tell me stuff, I'm like, think of this logically. They put this vaccine out. Who did they test it on? Who would they test it on that's willing to be able to do it? It's gotta go through a couple of people. Some people have to take it. Somebody has to take it.
You're gonna be a hero.
Yeah, somebody has to see it. It's not gonna be perfect right off the bat and be like, okay, it's ready to go now. Everybody can take it. He's gonna have to go through some of the kinks first.
I don't know if people realize how many studies for these vaccines there were. I mean, I know, it seemed like, it came out quick, which I guess compared to some other vaccines, maybe it did. But, there were a lot of studies being conducted. I mean, even at Prism Health, we conducted, COVID vaccine study.
Yeah.
Which we do. We conduct a lot of various different studies for different medications and things.
I was in the study and the vaccine study. I'm not dead yet.
Yeah. And we're so happy that you are with us, Dax. We're so grateful.
Dax isn't a zombie yet.
But I mean, if you do those other ones, what's the other vaccine that you have to take in order to work at some places, like the tuberculosis shot or something like that?
Mm-hmm.
Those had to be tested on people too. Those had to be tested too. It's another vaccine that we need to take. That's the way I'm looking at it. It's another one that I need to take to live my life normally. If that was the case, people would have tuberculosis everywhere. Mm-hmm. People would be having measles everywhere. Everybody would be having
smallpox.
Yeah,
smallpox was eradicated due to a vaccine. And if it wasn't for that, I mean, it would still probably be ravaging the world today.
Yeah.
Especially in the United States. I mean, it was pretty bad. But I think we often forget because I don't think people like the whole idea of someone trying to force them to be vaccinated, and I don't think it's so much as being.
You're forcing all of us to get COVID. Think of it that way.
You're not wrong though.
Yeah.
I mean, wasn't nobody getting COVID until I don't know. I'm just.
Well, if you think about it, I was saying, if you think about it though, our family, my mom, she was I don't know why. She was but I feel like Americans now are just they are just filling their britches too much. And I was like, what do you mean, Mom? She's like back in the day, in the 60s and 70s and stuff, people were much more willing to like be open-minded. She's like, now everybody has like a chip on their shoulder. They don't want to do this. They don't want any type of rules on them or regulations or any type of things that they want. They just feel way overly privileged. She was like, I just don't understand it. And I don't know,
Yeah.
maybe, maybe Americans are like that. Because I feel like every time something new comes out, like somebody is upset. If you say you have to wear a mask, someone is upset. If you say that you can't wear the mask, someone's upset.
I
If you
think
say it's so much stuff.
you know what I think it comes down to. I think it comes down to just like the exchange of energy between people in the form of attention. Like, I'll tell you a funny story, Sadie, and when you look at me, I feel cute about myself because you're giving me attention, you're giving me the energy, right? I think some people just want to be contrary without even thinking about it because they're like, oh, you guys all think this. I like the other thing. Or like, I just like, you know what I'm talking about?
Right.
Like, I went to a party the other day and it was like outside and we all sat down at this little table and it just rained. And then one person came out and was like, where are the cushions? I'm not sitting down unless there's cushions. Made a whole scene.
Whole scene.
Everybody
Please
else
stand up.
sit down. Privilege. It was just privilege. It was
just,
like,
yeah.
yes, and it's like, why do you just be quiet?
Just, and even if you want to, you could go over to the side and be like, hey, do you have some cushions? Like, you don't have to make a
Be
scene.
cute about it,
Yeah. Everybody, I feel like
it doesn't revolve around you. And
Yeah.
and that's a
walk
big
into the
thing.
Target. I'm not wearing a mask. They're taking my liberties and just screaming and just. I can't.
Yeah, that's I think again the world doesn't revolve around you, and that's like what public health is. It's about the public and people in general. Like it's not just about you. There are other, and maybe you don't know anybody who's gotten COVID, maybe you haven't gotten it, but there are, like, my best friend's dad literally just passed away today from COVID, and and it really sucks that people want to sit and wait until it happens to them to do something about it, when like, based on facts and science, that this prevents severe cases of COVID and deaths from COVID. It doesn't prevent you from getting it. Don't be misinformed about that, because that's what people assume, that it doesn't prevent you from getting COVID. It just prevents you from getting a more serious case. And it's crazy. Like, people think, oh, I'm fine, I'm okay, I'm healthy, I'm this. And it's like, you don't know. And it affects everybody in every shape, way, age, and form. And you shouldn't want to wait around until it affects you negatively, and it's like, and it got FDA approved today. The Pfizer vaccine got FDA approved today. And that was a lot of people saying, it's not FDA approved, it's not FDA approved. Vitamins aren't FDA approved.
But we take them.
There's some like energy drinks and stuff that aren't FDA approved.
There's a lot.
There's a lot
aren't FDA approved, but
Yeah.
It's so crazy. And it's like, and I mean, it's so, and then the fact too, I get really bugged because this, don't take away my rage. Like, okay, what
Calm down.
what can you not do now that you were able to do before? Like, nothing. Like, nothing changed.
Right.
And there are countries that, like, oh my, like, the whole country goes on lockdown. Like, you weren't able to leave your apartment or your house, or like you couldn't go outside, or it was like certain, like, we have it. Ain't nothing going on. Like, you know what I mean? It's so crazy. And it's interesting to see how other portions of the world handle it. And I think it was, see, I don't want to misinform y'all, but it was either somewhere, in Australia or New Zealand that they had done a lockdown, and like there were no COVID cases, and they went on living life normally, or how we were before, right? And then I think last week there was one confirmed case of COVID, and they shut the whole country down again.
Ooh.
Over one case. And and they traced it and tracked it, and like, we're not going to let people out until it was gone.
Meanwhile, we had like 4,000 in a weekend.
Yeah, they closed it down over one case, and it's like,
if that's the case, we would never go outside again. Basically,
literally, no, like,
like, there are people that get like an STI, like a bacterial infection, and they'll take enough of their antibiotics until they feel better.
Mm-hmm.
But not all of them, because it was already such an emotional struggle to get them in the first place. They don't want to do the whole, so they save them.
Mm-hmm.
right? And then in the meantime, they don't realize you feel better, but like you're creating like these like Avengers Endgame bugs inside you that are just going to get stronger and stronger. And I feel like the whole planet is playing this game right now with this virus, where people
Just
start
enough.
to feel better and they start going out and wilding out and doing whatever, and they don't just all do the same thing and commit 100% to this. And so then you get a new variant and a new variant and a newer variant. I'm anticipating a variant that's just like you just get sick so fast and it knocks you out so quick.
I mean, it's people think it's over. Like literally, I went to the grocery store over the weekend and this lady didn't have a mask on or nothing. And she was like, yeah, she was like, I mean, the pandemic's over. No one's having a mask on. And I was like, what world do you live in? Because this is Dallas and they just said they don't have any more ICU beds. So I'm confused. Where do you live? You must not be from here. And she was like, no, I'm from here. I'm like, have you got
I mean, when I go out now, it's like it's maybe like 40-60, like 40% wearing their mask, majority not. And then yeah, I still go to the gym, but I wear my mask there still. And I had one person was like, how do you wear that while you're here? And I'm like,
Better
it's
than
not
being
that
intubated.
I'm like, it's not that hard, first of all. And if I need to breathe, I'll pull it down for a second. I'll drink water, whatever.
Yeah.
But I'm used to it by now. I've been doing it literally since it began. And again, just never know. And and that's the gym too is a high risk place. You have people that are breathing really hard. They're sweating. They're walking around place to place, touching things, wiping their sweat. And I'm like, I wipe everything down still. I'm like one of two people in there with my mask. Like, I don't care to risk it.
I just
don't
want
either.
to remind me of like where we were.
Something
It just reminds me about like where we were before. Like before the pandemic, I tried to think about that and I was like, we were really dirty. Like,
I was talking with my brothers and we were like, how did we used to like go bowling? How did we go bowling and put our fingers in the bowling balls and then
put our shoes on and
corn?
someone else had shoes. Like someone else's shoes.
Yeah. It's
I used to work in a bowling alley and I was so proud of the fact that I could get like 30 pairs of shoes like lined up on my arms and carry them all back to the table. And that was gross.
Yeah, like I was like, I didn't realize how much we didn't like think about those things that much. Like, I mean, I always have had sanitizer. I've always had that with me, like in my purse and stuff like that. But
But
like,
you never ran out.
I always did it. Don't do me like that.
Come on.
I always had them. I always had it. I always used it. But like the extra stuff, like I probably didn't do that as much. You know what I'm saying? But now I'm like, oh man, we were really not. We're just out here wilding out. We're in the streets basically.
I think about
so you say you think about what?
the floor, like people walking
Oh,
around
yeah.
and then they bring their shoes inside and walk around to other people's houses and like we don't think about our feet. You know, there's a kid in the grocery store bouncing a little bouncy ball, like in the middle of the pandemic, just bouncing it up, picking it up, bouncing it up, picking it up. And I'm like, you gonna rein that in, ma'am? He's just
I'm not.
inoculating himself with.
She is not. You're trying to take away her son's liberty, her child's liberty.
I mean, get him a yo-yo. You don't ever even got to
Child
touch
don't even know how to spell their name. They better calm down.
But to me, why are they fighting? I have a hard time understanding why are they fighting so hard to try to remove masks from school when children are the most vulnerable right now because they can't get vaccinated at the moment. It's not like approved for I think children under 12.
And they don't care.
What is it going to take for them to realize that their child can contract COVID, can perish from COVID and bring it to the rest of the family? I mean, is it going to take children to start dying before people realize that it's not that big of a deal
100%.
for your child to wear a mask while they're sitting in their classroom? Like, this isn't to try to take anything away from you. This is to try to protect your children, other people's children. You
literally, I saw a lady.
Where's the disconnect?
She literally said she was screaming and hollering on this. It was a meet the teacher night, and she was like, I just want my child to see her teacher. I want her to be able to see her teacher. I don't want her to have to do school at home. And I'm thinking about it like, lady, you're not going to have a child in a minute. Like you're going to be picking out a gravestone for your child Like my child will be fine. She can see me. I'll be the teacher. Hi,
Sure.
this is meet the teacher night at home.
Or if you want to meet the teacher too, just wear the mask. Like,
Do it virtually.
what do you mean? I don't understand. Like,
If I was a teacher, I'd have been like, I'm trying to make sure I'm around for her to see me. I'm trying to stay alive. You got me in a whole fish tank over here.
yeah, the kids thing really. I mean, my little sister is 9. Today was her first day of 4th grade. But my mom sent us pictures with her little mask, like she went to school and stuff. But it's like, yeah, you don't know what the other kids' parents, like, you don't know if they're vaccinated or not. You don't know if the teacher's vaccinated or not. And they're going home and they're coming back every day. And now that I think now officially, like, most Texans are in school now, school has started, whether it was last week or this week. And I think that, yeah, cases are going to rise in children. And it's like, that's what I was saying earlier. Why do you have to wait for it to happen to you or to get bad in order for it to mean something? Because it means something, whether it affects, I'm getting passionate over here, whether it affects you or not, like, it means something to somebody else and it affects us as a whole, whether it doesn't affect you directly.
Well, then I thought it was really crazy that they said they weren't going to do contract tracing. So if your child gets COVID, you're not going to call me and say that someone in the classroom got COVID. So that means that my child is not even going to get a chance to be protected at all because her child ended up getting COVID and they didn't tell me that she got COVID. I'm like, are you serious?
That
I will fight somebody.
Privacy, Sadie.
That's bull crap. Because
That's crap.
No,
because you will call me. The daycare calls me when y'all get sick. When somebody gets chicken pox, no. COVID
or lice or something.
Yeah, like, no. I need to know somebody gets COVID at the school. Like, what?
These people don't see logic.
Dumb is
they
what
can't draw
it
it
doesn't
because
make sense.
people saying my body, my choice right now with this mask situation, but won't let women say that.
Oh, that's a whole nother one.
There are no parallels here to be drawn that people will see.
I just thought it was really weird about the mask because I was like, we've been wearing masks for a whole entire year. So don't try to get cute now and be like, no, I don't want to wear a mask. You've been wearing a mask since December of like 2019. I don't want to hear nothing. You wear this mask until it's over with.
And you're going to like it.
And you're going to like it.
No, and people too now are like, oh, I'm so annoyed with the mask. And I'm like, you're not used to it. I was like, I'm used to this, but it doesn't even faze me. I'm like, I've been doing this for the past 2 years. Whatever.
People crap on the people like that are driving with their mask in their car with the windows down. And they're like, hey, stupid idiot, you're safe in your car. But all I see is somebody that's so comfortable in their mask, they done forgot they had it on.
Yeah. And sometimes
How do you?
I want you seeing my facial expressions, so the mask is better because I don't want you seeing my facial expression.
My problem is the eyes. You can't hide that.
Smile with your eyes.
They tell the whole story. You guys, this has been an awesome conversation as it always is. Get vaccinated, wear your mask, keep yourself safe, do what's best for you, but know that, if you aren't, keeping yourself safe, I guess, then the consequences. And I guess in every sense of the word, death is a consequence of, not doing some of these things, or it can be, I guess, should I say.
It's really not. It's not just about you.
It's not.
Really.
Protect yourself, protect others.
Yes. And do your research. Read for yourself. You can
check peer-reviewed articles.
And check multiple sources. Don't just click the one and be one and done.
Yeah. At least 3. Just check on 3.
Yes, Dax. I was going to say that. At least 3.
Just 3.
Good sources now. Don't do 3 regular sources. Yes. Good sources.
Yeah.
And it's honestly just like a verification to make sure that things match. Because, and again, if you see something different elsewhere, then look up that and be like, where did this come about? And then you can, and again, make sure you have your credible sources, not somebody's vlog and blog and this and that.
Just try to get a sound bite to talk to your friends and sound cool and get attention. Because you get way much more attention if you say the right thing, the smart thing.
Right.
Take care of people.
Correct. Mm-hmm. Awesome. Well, guys, Sadie, Felice, Dax, thank you all so much for joining us. Sadie, I need you to come do my wall like yours.
I got you.
Sadie was
there. This was the one that I made at the Empowerment Center.
Oh, the painting?
Yeah, the painting.
Oh, we need to do that again soon. You guys follow our page at PHNTX Empowerment to learn more about when we're doing chat space and other events that we may have. I mentioned it earlier, but we do have this free condom and lube subscription service. It's really cool. You can go and like pick out what type of condoms you want, like what size you're looking
Work if
for.
it's backwards.
FreeNightsPackage.com. And Dax is holding up the QR code for FreeNightsPackage.com. So
let me see if it works. Leave it there, Dax.
Yeah.
you need condoms, lube.
It works.
It
let us
does.
know.
It works. Yeah.
All right,
perfect.
boys,
Okay.
I'm waiting. Everybody. Yeah, that is so cool. FreeNicePackage.com. We will send you packages of condoms discreetly to your door
For free.
for free every month. Variety, extra large. If you got a big old monster down there, if you've got a vagina, we send you internal condoms to put inside your vagina or your front hole. If you got a front hole, yeah, or you can put them in your butthole.
Non-latex condoms if you have allergies.
And if you don't
Different
like
types of
condoms, they're
lube.
not for you, we are working on an only lube version. So you can just lube all your hole up, dental dams, everything. It's a real blast.
You got it. We can do it.
Yes. Yes. And as we said earlier, if you have questions about things, contact us. If you have questions about STIs, HIV, want to learn more about PrEP, condoms, any of that, you can contact me at tedrick.douglas at phnTX.org. That is TEDDRICK.DOUGLAS at phnTX.org to learn more, or if you'd like us to provide more classes, or if you have topics that you want us to discuss, let us know. But anyway, thank you guys for joining us again and watching and tuning in, and we will see you next time.
Goodbye.
Bye.
Bye.